So good morning, everyone. So this is our first module, which is on Introduction to Environmental Health. Yesterday we had a brief introduction about courses and what is expected from this course. So in this module, we will mostly focus on aspect of environmental health. This will give you a background understanding of issues in environmental health that can be helpful in module 2 and 3 when you will read CBPR methods. I am Dr. Vishal Diwan, Scientist E at National Institute for Research in Environmental Health. And before going to our first presentation, I just want to give information about the learning outcome of this module. So the learning outcomes are, because you have also gone through this our course module in Moodle platform. So for this module, the learning outcomes are define common environmental issues like water, air, soil, and noise pollution, built environment, climate change, and their impact on human health. In this lecture or in module, we will also cover environmental disasters and environmental health inequalities. And then also we will discuss or inform about understanding environmental health and sustainable development, environmental health priorities and policies, and environmental health inequalities. So these will be our learning outcomes. So in today's session, we will have 4 presentations: Introduction to Environmental Health, Air Pollution and Health, Water Pollution, Soil Pollution. And then on 20th April, we will have presentation on built environment, climate change, and environmental health inequalities. I hope you have gone through the portal, Moodle portal, and there are some assignment discussion forums. There is also a quiz. So I will request you to read those assignments, comment on discussion forum. And if you have any further question or query, we can have a short question answer session after each presentation. So now I invite Director NIRE, Dr. R.R. Tiwari, to present his presentation on Introduction to Environmental Health. Thank you.
Shall I share the screen?
Yes.
Okay. Is my screen visible to all?
Yes.
Yes, sir.
Yes.
Yes, sir.
So very good morning. And again, yesterday I welcomed you. So today is the formal first day of this course. So I again welcome you. So I shall be presenting my case for the environmental health. So why we want environmental health at all to be studied? So we all know it is not changing, I think. So we know that we are surrounded by many things around us, which constitutes the environment. But then it is not always possible to study each and everything which is surrounding us. So for the purpose of study, we have to define that what we are going to study when we say environment. So first and foremost thing to which we are surrounded nowadays is the physical environment. Definitely, there are a number of buildings, there are fans, there are almirahs, all other physical things, because in our quest for the development, we have done all those things. So we are surrounded by many physical things. So that is physical environment. And when we say physical environment, definitely the built environment component of this course will take care of all these physical environment and how it affects the human health. Then if we go still beyond this physical environment, if you go outside this building, then we have many things in the nature. be it mountains, be it trees, be it rivers, all other things. So these natural things definitely have impact on human health. Again, when you see in the nature and in your surrounding, you have a number of other living organisms, be it human being, be it animals, be it plants. And so human being interact with all these living things. And so it creates a social environment. And that also has an impact on human health. And then when group of people, individual, they interact among themselves, behave in a certain way, so that gives rise to the behavioral environment. So when we say environment and when we want to study environment and its impact on the human health, we talk about physical, natural, social, and behavioral environment which we want to study. So what is basically environmental health? As you know, the health is physical, social, and mental well-being. So not merely absence of disease. So in this case, this science also works on the same principle where we want to prevent and control disease, injury, or disability which may arise because of people interacting with their environment. And so two steps science is environmental health. First, we identify what are the environmental sources, what are the environmental agents which have potential or which are causing the harmful effect on the human health. So we identify it, and wherever possible, wherever we have tools, we want to monitor it or evaluate those environmental causes. And then we put the principle of prevention there or protection there so that the exposure or the interaction of people with these harmful environmental sources is minimized. These environmental sources can be in any form, can be physical, can be chemical, can be biological, and may be present in any of the media, water, soil, air, or any other environmental health. So they have the potential to affect the human health. And so our focus is to limit the exposure to the human being and thereby prevent the deterioration in the health. Broadly, if you see environmental hazards, these can be classified into two types. One is traditional, which is because there is lack of development. So when there is lack of development, there may not be safe drinking water, there may not be proper sanitation, food contamination is prevalent, indoor air pollution, people are relying on the biomass fuel for their cooking fuel, then inadequate solid waste disposal, natural disasters. So these are the traditional hazards. And then with more and more development, and these development largely being unsustainable, give rise to a newer set of environmental hazards, such as chemical pollution, maybe in environment, maybe in water, urban air pollution, hazardous waste accumulation, chemical hazards, radiation hazards, re-emerging infectious condition, deforestation, land degradation, climate change. So all these are the newer set of the modern environmental hazards with which entire globe is struggling, and we are not left behind. Broadly, if we want to see what are the principal causes of environmental hazards and with which the entire globe is struggling, so WHO has identified these hazards which are of prime importance with respect to environmental health. Air pollution, we all know every year we see problem in the winter season. Many of our metros, they struggle with air pollution, the smog and other thing. Inadequate water sanitation is still a big challenge for the developing countries like ours, where the health condition because of inadequate water and drinking water and sanitation still holds a big chunk. Then there are chemicals in all media, food, soil, water, air. Radiation hazard is there. Noise, which is a silent killer, we don't pay much emphasis, but then it is definitely important pollution. The climate change with which for which every country is coming on same platform and want to act on that. Built environment, I have already told, when we built luxurious houses or buildings for us, we forgot that it also has a health impact. So these are some of the environmental hazards with which the globe is struggling. The magnitude is also important. So if we see top 10 causes which has an environmental component in it, so these are the 10 causes, be it stroke, IHD, unintentional injuries, cancers, respiratory conditions, diarrheal diseases, respiratory infections, intentional injuries. So all these have some or other component of environment. And so when we want to prevent death because of these important causes, we have to act on the environment part of it. Again, in terms of death and DALYs, almost 1/4 of the deaths and 1/4 of the DALYs is directly attributable to the harmful environment. So that begins the problem. If you see in absolute terms, WHO says that 7 million deaths are occurring each year because of air pollution, and more importantly from household air pollution, with which many of the developing countries are still struggling. Indoor air pollution is a big problem with us, but thanks to current government with the Ujjwala scheme, we try to replace these harmful domestic fuels with the cleaner fuels, but then still it is a problem in greater part of the world. 2.6 of almost 1/3 of the world population is struggling with the household exposure to harmful fuels. And so if you add ambient air pollution to it, 91% of the world population is exposed to one or other form of air pollution. Same is the scenario for the water and sanitation. 26% of the world population, they do not have access to safe drinking water. Half of the population, they do lack the basic sanitation services, and then 2.3 billion people across the globe, they lacked hand washing facilities. And you might recollect in the last 2 years since the pandemic started, what is the importance of hand washing in preventing not only in terms of figures, but also in terms of cost. It is a costly affair. So, if you see, can you please mute your mic? So, in terms of cost also, it is a costly affair. So, it is taking a considerable chunk of GDP. 13 to 14% in cities like Delhi and Lucknow is devoted to air pollution cost. And this is not peculiar to us. It is present everywhere across the globe, be it Tokyo, be it Shanghai, be it Beijing. So they are losing certain proportion of their GDP on tackling air pollution cost. When we see India, 1.36% of India's GDP is lost due to air pollution, and major chunk is because of death, which is attributed to air pollution. And per capita, we are losing around $26.5 to the air pollution. So for mitigating, for treating, and all other things related to air pollution. So we are losing a good chunk in this environmental condition. If you see another environmental condition, that is diarrhea, which is still a very big number in our country. So again, if you see the factors which are responsible for diarrhea, 77% is because of inadequate wash, 54% is unsafe sanitation, 70% is unsafe water, and 34% due to lack of hand washing facility. So minimum, if you can work on providing proper hand washing facility, at least 34% of the cases of diarrhea you can prevent, so which is a big number. So these are some of the simple things which require to be addressed, but then have very greater implications. As we all know, all these environmental pollutants can enter the body system either through the respiratory system or through the gastrointestinal system by means of water, food, and soil. This is the web through which these environmental pollutants ultimately reach the human receptor. For air, there is a very simple mechanism through inhalation, through respiratory tract. It affects the respiratory system. But for other, the pollutant in other media like water, soil, and food, they have a different web and complex web, and through which it reaches human receptor and thereby affect the human health. The effects which these environmental pollutants will have can take any proportion. There have been instances where it has been acute environmental catastrophe. There are certain examples, Minamata disease for methyl mercury poisoning, or TCCD leak, or Bhopal gas disaster, or nuclear incident which took place in Chernobyl, or cryptosporidium epidemic or outbreak which occurred in Milwaukee. These are some of the examples of catastrophic nature of the environmental condition. But then, more importantly, what we are facing today is the chronic low-level exposure. So all sort of toxicity, all sorts of chemical poisoning, whether it is heavy metal or EDCs, all these are the chronic low-level exposure which is occurring, and these are, after a latent period of a decade or two, is manifesting in different conditions. So that is a big challenge which we all are struggling with. But then, because it also has indirect effect on the global environment, because somebody generating more carbon footprint is not only restricted to that particular area, it affects the globe in general. And that is the classical example is the climate change. So in some part of the country, a lot of GHGs are generated. The other part of the world is also equally affected. So it also has a large indirect effect on the global environment. If we want to see, and many times we don't pay that much importance to environmental health conditions unless until we ourselves are a victim of this, is because if you see the pyramid of environmental health effect and particularly the severity, it is usually a tip of iceberg which is visible in terms of significant environment impact. So large population is exposed and very few number, they die because of this. And still there is controversy about those deaths. We always say the conditions like cancer, the conditions like allergies, we always play or we always imply the genetic manifestation or genetic makeup on or causing these conditions. But then, yes, as it is rightly said by Davis, that genetics make person susceptible, but then in the right environment, this susceptible genetic composition results into human disease or human health. So environment pulls the trigger. So if there is a favorable environment to initiate that disease, and it manifests in disease. So how to address this problem? We have traditional way of researching. So either we measure in numbers, so do we do qualitative study, or we can have in-depth opinion of the community through qualitative studies, through observing the thing. But then there is another tool called as community-based participatory research, which I said yesterday also, because environment is one such condition where everybody is stakeholders, and community is a main stakeholder, because the problem which we are facing in deterioration is environment. To large extent, community is to blame. And so community has to come forward to address this problem also. And that is why we designed this course so that community can be involved in the scientific efforts or in academic efforts towards tackling these environmental health issues. So what we want to do is we want to have an environmental stewardship model. We already have clinical intervention model where once the disease occurs, we try to treat those cases so that the death can be delayed or that can be prevented. Or we have the public health intervention model where we put certain efforts, preventive efforts, so that the public, though it is exposed to hazardous environment, doesn't develop disease and thereby death. But then what we exactly want to safeguard human life is the environmental stewardship model, where we want to protect the environment. So there is no question of disease and death. So Ujjwala scheme is one where we want to make environment safe for the ladies who are cooking in the houses, and particularly in the kacha houses in the rural area. So these are some of the examples where we can act through this model and thereby make our environment safe. And the issue is important because if you see the SDGs, out of 17 SDGs, 9 SDGs talk about the environment. And so the entire concept of sustainable development is to prevent the or conserve the environment in the best possible natural way. And so in the last, I must say that if we want to develop sustainably, then definitely we have to take care of our environment. And if we are taking care of our environment, the development which will be resulting will be a sustainable development. So I complete my deliberation here. Thank you.
Thank you, sir. So we have some time to take 1 or 2 questions. Otherwise, you can also put questions on discussion forum, but we can take 2-3 questions here. I think Mr. Paul, you can ask.
Yes. Yeah. Thank you. Simply, one thing is because as the program is in reference to the community based. So when we say community, so what usually we perceive in terms of like community is like the people who are impacted by because of this, or the community is like the industrial community, the scientist community, the people is also one community. So how we'll define the community? Because otherwise it appears it's a giver and receiver kind of thing.
No. See, when we say community, everybody, and that is why I always say that every single citizen is a stakeholder. So when we want to address community, it is not that we are going to address only the village people. Yeah. We also address the community people, those community which is responsible for putting the preventive measures there. We are also talking to that community which is responsible for monitoring of air in that particular region. So community means the broad, and that is why every single individual has a role to play. It can be an administrator, it can be an academician, it can be a villager.
Yeah, I think that definition. Otherwise, what I've seen, I work in community, sir. So mostly the people, it's like, wash also the community should understand. It appears like more community is the recipient end.
No, if,
so that's
through,
definition
through our,
we need to.
If you see through our experience, if you say that community should understand, community is already understanding. They do not have means and resources to do. So, and that is why we want to provide a link between those who are health or care providers and those who are at the receiving end of that.
Thank you, sir. I just want.
Any further questions on this? Anything you would like to ask?
Sir, may I ask you one question?
Yes.
Yeah, please.
Sir, I don't know if it is exactly related to the topic that we have dealt with, but I'm in Kochi right now in Kerala, where one of the major hotspots is called Elur, where there is an industrial area has been flourishing, and there are a lot of people are identified with cancer. So as we can see that, the surge of industrialization and also the impact of this upcoming urbanization is the major cause for this, or factor for the deterioration of environmental health. Is that right, sir?
Sure. And I think if you are from Kochi, last month our team was in the Brahmapuram waste treatment plant. So you had an incident there
Yes, yes.
These are, so that's why I said when we listed the causes for the environment. So occupational exposure is one such thing. So the people who are working in the industry, they are exposed, but more importantly, these industries are liberating a lot of chemicals in the environment and thereby affecting the environment. So these environmental chemicals are responsible for the consequences like chronic diseases or cancer. All this has been proven that these chemicals, they do play a role in causing these chronic diseases.
But what I found is a very paradoxical manner or a contrasting aspect is that for a developing country like India, we can't neglect the concept of urbanization or industrialization because we have to have the GDP rise, we have to have the development happen. But paradoxically, there are a lot of issues happening there at the end, at the other end, right, sir?
That is why what we want to make people aware that there are also sustainable way of developing. So we should adopt those models of development so that we are also developing and at the same time we are not deteriorating our environment to a larger extent.
Okay. Thank you, sir. Thank you so much.
Okay, so thank you, sir. Now we can, I invite Dr. Tanvi.
Hello, everyone. Am I audible?
Yes, yes.
Yes, yes.
Okay. Yes, I'll start sharing my screen and then I'll start presenting. So is the screen now visible to everyone?
Yes.
Yes.
Okay. Good morning, everyone. So let me introduce myself briefly. I'm Dr. Tanvi. I'm working as Scientist B in ICMR NIRE. So the presentation for me today would be basically focused on air pollution and human health. So as Sir has already given you an idea about how environmental factors affect human health, and I'm sure that air pollution is a topic that has been discussed again and again on different fora. So most of you would already be aware of the basic tenets involved in air pollution. So let us try to make this lecture kind of an interactive one wherein we have a discussion instead of me just talking. So let's begin. So basically, when we say air pollution can be either anthropogenic, man-made, or it can be natural. So can any one of you unmute yourself and tell me if you can understand, what do you understand by natural versus anthropogenic? Do you have an idea how it goes?
Yeah, natural one is that which is occurring naturally without any intervention of man. Whereas the other one, that is anthropogenic, is man-made disaster, which is caused by due to the action of people as human beings.
Yeah, exactly. So it's like natural, there are sources of natural air pollution like volcanic eruptions, like forest fires, desert-based dust remobilization. But the major problem that we are dealing with today is basically air pollution that is caused by human activities, traffic, industry, agricultural emissions, so stuff like that. So that is where our focus is nowadays, to try to mitigate and reduce the amount of air pollution that is generated by human activities. So before we move on to understand, it is more meaningful to try to understand what exactly we mean by air pollution. So there are multiple definitions around the globe. Different authorities have defined in their own ways. Since most of us are working in India, the definition that is used by Indian authorities, wherein the Environment Protection Act of 1986, air pollution is defined as the presence in the atmosphere of any solid, liquid, or gaseous substance in such concentration that it can be injurious to not just human beings, but also other creatures, plants, property, environment. Now, if you note here, an important concept is that noise is also included under the definition of air pollution by EPA. Now, coming to air pollution, there can be various types of air pollution. I'm sure all of you would have paid attention in Sir's slides previously, he mentioned about how household air pollution is an issue that is affecting developing countries. And also we have the issue of ambient air pollution. So by ambient, I mean the definition states that air pollution that is occurring outside by sources like traffic, industrial pollution, etc. And by household, the pollution generation, the emission occurs within the limits of the houses and indoor environment. So household does not specifically limit itself to just houses. So any occupational setting, any commercial area, so inside the limit of the indoor setting, so that emission is household air pollution. So I just want to ask a quick question here. Do you think when we say that household versus ambient air pollution, do you think these are two watertight compartments without any link with each other? Any idea?
I think they are very well connected in terms of, because once person is exposure outside, that also brings that pollution inside.
Yes, so it's kind of like there is a diffusion of pollutants inside and outside. So it's like household air pollution comes out to the neighboring environment and the ambient air pollution comes into our home. So even though most of our statistics have different values for HAP versus AAP, it is kind of like these are not watertight compartments. So these exist in a kind of a dynamic equilibrium with each other. So even though if you go through the literature that has been published in I'm sorry, just okay. So common air pollutants. When we talk about air pollutants, most of the time they are divided into two categories: particulate and gaseous pollutant. So can someone give me a clue of how you consider these pollutants? Can you give me a few names that you know?
Suspended particulate matters.
So there are classes among particulate matter. So is anyone of you aware of how particulate matter is divided? What are the common classes under particulate matter?
Is it based on the size of this particulate matter it is classified,
yes,
ma'am?
Yes, exactly. Okay. It is classified according to the size of particulate matter. So we have basically, we use kind of definitions like coarse particles, wherein we consider them as PM10, wherein the particle size, the aerodynamic size of the particle is less than 10 micrometers. And we have PM2.5, we have PM1. So PM1 is the nanoparticle fraction of it. So now coming to gaseous pollutants, again, we have multiple gases that are considered to be pollutants when they occur in excess of their expected threshold in the ambient air or in the household air. And then when we talk about pollutants, again, some are considered to be more prevalent in the ambient air, like nitrogen oxides, sulfur dioxides. So these are supposed to be pollutants that are problematic in the ambient air because their source of emission is mostly traffic, industries. And then we have a category known as volatile organic compounds, which mostly originate either from industries or from household sources. So normally when we try to look at the pollutants in different compartments, like in the household, we try to look at what is the level of volatile organic compounds, what is the level of carbon monoxide. So, and when we talk about ambient air, we focus more on like ozone and nitrogen dioxide, sulfur dioxide, etc. So, like I said before, that particulate matter is divided into different compartments or different types, categories, just for understanding, because obviously when the environment, all these occur simultaneously, but trying to differentiate their effect on human health, we have divided them based on size. And if you can see in this slide, this kind of gives you an idea of how small these particles are. So a single human hair is around 50 to 70 micrometers in diameter. But when we are talking about PM 2.5, these particles are lesser than 2.5 micrometers. So their aerodynamic size is almost 30 times lesser than a single strand of human hair. And then another important concept that we really need to remember here, that PM2.5 itself is a composite mixture. It's not like it's one single particle. It's kind of a heterogeneous mixture of different pollutants that are piggybacked upon these particles. So we have heavy metals, we have organic components, which are carried by these PM2.5 particles. So when the newer concept of trying to understand the health effects of these particles focuses not just on the concentration of these particles, rather their composition. So it is important to understand what components these particles carry and how that translates into human health. So since air pollution seems to be a major problem worldwide, so around the globe, multiple agencies have come up with something known as threshold values. So these are the guideline values where countries and different cities are supposed to maintain their pollution levels below this. So it should not be exceeded. So in this slide, I have shown the guideline values provided by 4 authorities in India. We have the Central Pollution Control Board, and it has its branches in different states in India. And the values are kind of old. They were given in 2009 and are supposed to be modified in 2023, sometime almost this year. Then we have the values given by the Environment Protection Agency of USA. The values were given in 2014. Then we have WHO, and WHO has just recently updated its guidelines in 2021. So it has made it quite stringent compared to the 2005 guidelines. And finally, we have the European Commission, environmental air quality standards prescribed in different European countries. Now, if you see here, according to the government, the authority that has prescribed it, it seems that the values are quite different. So if you particularly look at sulfur dioxide, it seems like the US values are quite different from the other values, but actually it is because of the play of the units. So if you see, the units that are used are different. So in one, we have parts per billion ppb, whereas we have μg per meter cube, microgram per meter cube. So it seems as if the values are different, but this difference is due to the difference in units. So this is one thing when we try to read through articles, this is one that gets confusing. So it is important to understand how these conversions work. So we have a standard formula for these conversions, wherein the molecular weight of the gaseous pollutant or the particulate matter is important. And for example, here I spoke about sulfur dioxide. So if you see, the 75 ppb actually translates into 195 μg per meter cube. So the difference is not that significant. It just appears to be so. So this is one thing that is important to understand while trying to interpret publications. Then one more thing that I want to highlight here is the differences in the WHO standards. In 2005, WHO limits, threshold limits for PM10 and 2.5 have been given here in the slide in yellow boxes. And you can see that the current levels have, the 2021 guidelines have been made to be more stringent. And unfortunately, in India, if you can see, our guidelines are quite old right now, and we have quite a liberal way of assessing. And even then, most of our cities kind of exceed these values. WHO says that if the PM2.5 levels are maintained below these new guidelines, then almost 80% of the deaths that are attributed to particulate matter can be prevented. But another concept or thought that is being taken up by researchers right now is that there is a chance that we have no safe limit. Even though we have these guideline values, studies have reported effects at way lower threshold levels. So another important or a disturbing concept, I would say, is that there might be no safe limit. Moving on. So we have something known as the air quality index. So can one of you tell me, have you ever been able to go through the CPCB website? Have you ever seen what exactly is an air quality index? Can one of you tell me if you understand this? Okay, no issues. Let's move on. So air quality Okay, air quality index is basically, see, in the last slide, if you had seen, it was kind of a very confusing concept. So when we are trying to convey the information to the general public, it might be very difficult to make them understand what all these numerical data, these ppbs and μg per meter cubes mean. So to make it understandable in one go, wherein it is quite easy for the common public to interpret, the concept of air quality index has been taken out. So it is basically a scheme that transforms the short term. By short term, I mean 24-hour means of particulate and gaseous pollutants. So there are guidelines of how these air quality indexes are calculated in India. It says that 24-hour means of minimum 3 of at least 8 individual pollutants, of which either PM10 or 2.5 has to be included. And that is converted into this concept known as the air quality index. And for every single pollutant, the index is calculated. The worst subindex gives the overall air quality index. And then they are color coded according to these values. So from 0 to 500, they are broken down into 6 criteria, 6 categories, with green meaning minimal impact, minimum health impact, and that the air quality is good. And red, or the severe one, means that it can affect even healthy population. So and CPCB has a real-time website wherein gives the real-time data of different cities, how the air quality changes on a real-time day-to-day basis. And it is also, if you have like seen in multiple cities, it is kind of in like here, I have shown the European Air Quality Index. Same, almost similar one occurs in US also, but the numerical comparison and the index calculations vary slightly. It is according to the country itself. So there are minimal changes, but similar quality indices are used around the globe. Now, moving on with the burden or the health effects of air pollution. So I'm sure all of you would have heard time and again that air pollution has been linked to multiple premature deaths and loss of DALIs around the globe. So can one of you tell me, do you have an idea how many million annual premature deaths have been attributed to air pollution? Any clue? Anyone? Just a guess, wild guess. It's okay.
Must be millions.
Yeah, it is millions. I just wanted how many millions? I mean, like, okay, it's
70 plus.
No, it's 7 million.
7 million, sorry.
Yes, yeah. But at least the number was similar. So 7 million premature annual deaths. And like, I'm sure many of you are from a public health background. So you would have been aware of how tobacco exposure has been considered to be one of the biggest risk factors for human health effects. And so if I'm trying to compare air pollution with tobacco exposure, so tobacco exposure leads to almost 8 million annual deaths. And we have air pollution, which is coming almost closer to that level. So there has been a lot of discussion, a lot of controversy about which is more problematic. But I would guess it is rather more important to understand that air pollution itself is a major risk factor and is leading to multiple deaths. And these deaths, if we try to mitigate air pollution exposure and we try to limit our personal exposure to air pollution, then many of these morbidities and mortalities can be avoided. So WHO has given this pie diagram, if you can see this pie charts of how the total percentage of deaths attributed to air pollution, ambient and household vary. And you can see the major diseases that are actually linked are ischemic heart disease, stroke, COPD, lung cancer, and acute lower respiratory tract infection. So unfortunately, almost 91% of the global population resides in areas where the ambient air pollution is higher than the levels prescribed by WHO. And let me remind you that this 90% is calculated based on the WHO 2005 guidelines. So if we look at the 21 guidelines, most probably it might be possible that even higher percentage of global population is exposed to the exceeded levels. And another important concept here is that even though air pollution is gradually being reduced in high-income countries, it's a major problem in LMICs. I think one of you raised the pertinent topic in our discussion previously that this is a very important concept in developing countries where we have to balance our air pollution exposure with development and how to make it sustainable. So this is an important concept because almost 90% of the deaths of air pollution related deaths occur in LMICs. And as you're aware, almost 82% of the world population is covered under LMICs. So in that situation, it is very important that most of the work or the interventions regarding air pollution should be focused in LMICs. But unfortunately, till date, if you look at the publications, most of the work has been done in high-income countries. Then when we speak of air pollution, we normally talk about the mortality caused by air pollution. We were talking about premature deaths caused by air pollution. But if you look at this pyramid was developed by the Environment Protection Agency, EPA, US EPA, and they have a open access Windows program, which is known as the Benefits and Mapping Analysis Program, BENMAP. So that has kind of given this pyramid to try to make it more apparent how air pollution affects human health. So even though we keep on talking about the deaths is only just at the tip of the pyramid, and the major problem is actually millions of people are being affected by the subclinical problems that are caused by air pollution, like lung function decline, cardiac effects, inflammation, oxidative stress. So these things are not apparent. So it seems that people, even though they are being subclinically affected, they are not aware of what is going on. Previously, I mentioned that particulate matter is divided according to the size. So why is that? So size is something that determines how particulate matter will be affecting, because respiratory tract seat is the main portal of entry. So depending on the size, the penetration of these particulate matter is decided. So coarse particles, they get limited to the upper airways, whereas fine particles like less than 2.5 reach to the lower respiratory tract, terminal bronchioles and alveoli. And even more problematic is that particulate matter 1, PM1 fraction, actually has been reported to be found in multiple faraway organs. Like it has been reported in the placenta, it has been reported in human brain. So it can even cross the pulmonary barrier and has been reported in multiple faraway organs. So that is why size matters. But when we talk about gaseous pollutants, it is their solubility that matters. So gases with high solubility get deposited and affect only in the upper airways, like for example, sulfur dioxide. But those with low solubility, like nitrogen dioxide, they can penetrate and go up to the terminal bronchioles, alveoli, and affect the respiratory system. Now, the effects of air pollution, even though the portal of entry is mostly through the respiratory system, it is not limited to the respiratory system. The effects have been discovered or have been reported in multiple organs of the human body. So if you can see in this diagram here, I doubt there is any organ system that has not been reported to be affected by air pollution. But you might wonder how that happens, because like I mentioned previously, particulate matter can penetrate only up to a limit. So it is not just the particles penetrating themselves. It has been reported that the pathways through which these effects, the faraway organ effects occur, can be through inflammation, through oxidative stress, through genotoxicity, through immune dysfunction. So these are the common pathways, but we still are underway, like the research is still going on to identify how each disease, what are the pathways for each disease, and it's still quite ambiguous. So coming to the health effects of the respiratory system. So can any of you tell me why I have this photo of the Great Smog of London? Do you know the story behind this? How air pollution was and what happened? Anyone? Any idea? Okay. This Great Smog of London occurred in 1952. And coincidentally, during that time, multiple incidences of COPD were recorded, and doctors in London were seeing that there were multiple new incidences of COPD, multiple cases of exacerbation of chronic obstructive pulmonary disease. So this was kind of the starting or the trigger point of wherein people started wondering if air pollution, short-term exposure at least, can lead to human health effects. So if you look at the history of air pollution related health research, most of the papers or the bulk of the work started after the Great Smog of London. So this is one of the earliest evidences of air pollution affecting human health. But unfortunately, till date, we do not have a consensus to say whether short-term exposure to air pollution can actually lead to an increase in COPD incidence, even though that was kind of the trigger. So there are kind of contradictory evidences from countries around the world. So if we talk about India, in 2019, almost 1.67 million deaths were reported due to air pollution. And of that, the largest proportion was from respiratory causes. And as I have told before, that the effect can occur at a subclinical level. So there have been multiple studies which try to look at the effect of exposure to different types of air pollution and their effect on pulmonary function. And for example, one of the areas that I was working on was crop residue burning. So it has been reported that exposure to the burning session, the season during burning in North India and Punjab, Haryana, can lead to decrease in these pulmonary function parameters and these spirometric parameters. And the decrease has been found to be sustained even after cessation of burning. So air pollution has been linked to both communicable and non-communicable diseases. So non-communicable diseases is because of the chronic inflammatory and the chronic oxidative stress that is caused by air pollution, and multiple diseases like COPD, asthma, allergies, cancer, etc. have been linked with air pollution. But we also have an association between exposure to air pollution and increased incidence and increased risk of infectious diseases, like, for example, pneumonia. So recently there was a study that tried to calculate the incidence of pneumonia that is associated with crop residue burning, and it was found that children are at 3 times higher risk of having an increased risk of pneumonia during the crop residue burning season as compared to adults. So the concept of vulnerable population that is affected by air pollution is important. Another organ system that is majorly linked with air pollution is the cardiovascular system. So air pollutants have been known to decrease heart rate variability, have been known to increase blood pressure. There are studies that try to link air pollution, particulate matter, particularly exposure, with occurrence of atherosclerotic plaques in blood vessels in our human system. So all these risk factors for ischemic heart disease have been linked to air pollution, as well as ischemic heart disease itself. A recent meta-analysis reported that for every 10 microgram per meter cube increase in long-term particulate PM2.5 exposure, the risk of incident myocardial infarction increases by 8%, and the mortality risk, hospital-based mortality risk, increases by 23%. And in India, the air pollution-related premature deaths, 29% occur due to ischemic heart disease. So this is a system that is adversely affected. And then we have mental health that is again adversely affected by air pollution. So I'm not going into the details of everything because I just want to give you a snapshot of how air pollution affects human health. So it has been reported that for every standard deviation increase in particulate matter level, the probability of mental illness increases by almost 7%. And it has been shown that a recent study, they were looking at healthy population, and it was a MRI-based study, and they found that exposure to air pollution can lead to actually structural changes in brain volume, like the cerebral volume, reduced cerebral volume, and it led to infarcts, covert infarcts in the human brain. So air pollution has been linked to both developmental and degenerative neurological disorders, like neurodevelopmental disorders like ASD, autism spectrum, ADHD have been linked. So there are multiple studies, cohort studies, which have been done starting from the antenatal period and following up the child till age of 5-10 years. And they have looked at the incidence of autism spectrum and ADHD. But most of these studies have been focused on particulate matter, and there's hardly any evidence. So it's quite inconclusive related to gaseous pollutants. And air pollution has been linked to dementia, has been linked to stroke. Particularly the 2017 Lancet Commission actually identified air pollution to be one of the major risk factors for dementia. So, and another important area of research that is ongoing in mental health is the connection between air pollution and psychiatric diseases. So there have been multiple systematic reviews that have tried to identify or synthesize the evidence between effect of air pollution exposure in terms of psychiatric diseases. And almost all psychiatric diseases, starting from schizophrenia to suicide, depression, etc., have been linked to air pollution, but the consensus is still pending and the research is ongoing. But even though I have highlighted the three major systems, organ systems that are affected by air pollution, the newer concept is that there is exactly no organ system that is not affected by air pollution. So almost every organ and every cell in our body might be affected by air pollution. And particularly important is that maternal exposure to air pollution has been linked to adverse birth outcomes. So it has been linked to preterm and LVW, and possible links with stillbirth and congenital anomalies. So it has been like linked to almost everything: skin, eye, endocrine, kidneys, etc.
Hello, everyone. Good morning. Hello, Professor Sandra. Hello, Dr. Raj.
Good morning. Good morning.
Hello, good morning.
Hello, Dr. Tapasri. Hello, Dr. Raj.
Okay, can I continue? Okay, so before we move on, I would like to kind of ask you, can you tell me a couple of interventions that has been planned or done? Because I have given a brief idea of how air pollution affects human health. So can you tell me some interventions that have been done at the government level or that actually we can do at our level to mitigate these effects? So any clue of how we are trying to work at it? Anybody?
I think the one is even raising awareness, kind of, sharing that what color coding kind of thing, so that people at least know that what is a good air, bad air kind of quality.
Yes.
So that sharing of this data, that is.
Yes. Any government policies? Are you aware of any government policies that have been taken in India to, kind of target air pollution? So are you aware of anything like that?
In the transportation sector, I could say maybe moving to BS6 or phasing out of diesel vehicles, something like that. Moving to electric vehicles.
Electric vehicles.
Yeah,
exactly.
There's a national clean air program launched.
Yeah, perfect. Yeah, NCAP. So the National Clean Air Program. So in India, basically, I would say that, like some of you mentioned, that we have this change in the motor vehicle designs, BS4 to BS6, diesel to CNG, electric. So, and regulation of, heavy duty traffic in heavy duty vehicles in residential areas, regulation for industrial emissions, and for household, we have the Ujjwala Yojana. But more importantly, we have the National Clean Air Program. So the National Clean Air Program kind of, targets non-attainment cities. So these are smart cities, and their air pollution data from 2014 to 2018 has been kind of combined to identify 122 non-attainment cities in India. And the target is to reduce almost by 20 to 30% of the PM particulate matter emission in these cities by 2024 compared to 2017. So we have multiple government interventions that are being done, like there are bans imposed by the National Green Tribunal on different environmental emissions, like air pollution emissions. Like you might be aware that there are bans on crop residue burning imposed by NGT, there are fines imposed. So multiple interventions government is trying to do, but like one of you mentioned, that it is important to actually involve the community to make them aware. Because even though there are interventions and there are policies at the government level, it is not kind of translating into the effects that would actually help us. So it is important to make the public aware of the problems faced that they are facing, the health effects that can be caused by these, and what they can do on their own level. Like recently, there was a systematic review which looked at how individual level interventions can actually lead to reduced effect of air pollution. Like they looked at like use of face mask, which has become more common, after COVID-19. So use of face mask, use of household air pollution filters like the HEPA filters, and then increasing use of public transport, reducing idling of vehicles at traffic junctions, carpooling, kind of shifting to greener modes of travel. So it's important to make the public aware. And that is where this course kind of comes into picture. It is important to involve the community to use the methods of CBPR to not just make them aware, but to make them a party to the generation of evidence. Because most of the time there is a kind of the community is skeptic towards the results that are published. So if we, kind of involve them in the generation of data, and they are a party to the collection of data, to the interpretation of the data, then obviously it will be much more easier for them to understand how the effects go and how they can work. So it's kind of like co-creation of data. So that is an important concept that will be covered in subsequent slides. So this is all from my end. If there are any discussions, I think we can go on.
Thank you. We can take one or two questions.
Is it it's a question, or is it possible kind of the color coding? Hello.
Yes.
Yeah. So like when we share more of a color coding kind of thing with the at the community or any level, so people still not that proactive or engaged. But as you mentioned that behind those colors, so what are the different kind of the CO or other kind of pollutants? So, and it may be like how we can be more aware in terms of whether we may be the contributor in that, those kind of things. So how we can be more action taking in that direction as well. Otherwise, color just people say, yeah, it's a good and bad kind of thing and forget about it.
Yes. So yeah, the concept is the color-coded air quality is just to make them aware of the level of air pollution. But yes, obviously the science behind it, if we can convey which all pollutants and which exactly which levels have been exceeded and how that has been emitted and what is their action or what is their, I would say, what is their contribution. So that kind of information sharing with the public is important. So that is where I think the concept of CBPR comes into play. So you are kind of collecting the data with the public. So if you are whatever air pollution data that as researchers we collect, so if we can do it with the public, with the community wherein we are working, so they are aware of exactly what is happening. So I hope I
just a small query.
Yes.
I just wanted to know for my awareness that is the air pollution in the rural areas also alarming, especially the household air pollution?
Yes, that's a very important question, I would say, because in rural areas, when I was talking about air quality index and I was talking about CPCB monitoring, unfortunately in India, we do not have CPCB monitored data from rural areas. So most of the air quality indices and the real-time data that is reported by CPCB is from urban areas.
Because we might have a lot of diseases which are arising from the home pollution, air pollution.
Household air pollution, there has been a lot of publications in India. There has been a lot of cohort studies wherein they have looked at the levels of household air pollution and the effect on those who are exposed, which is mostly women and children. So household air pollution is a concept that is applicable to both urban slums as well as rural areas. But in rural areas, there are multiple other sources of emission, like agricultural emissions. So the normal agricultural activities tend to produce a lot of dust remobilization. So the PM particles that are generated during threshing, during different agricultural activities. So there is a dearth of data on that, at least in India. So most of the agricultural data, pollution related, has been focused on crop residue burning. But even normal agricultural activities. So yes, that is an area that needs a lot of active research.
Thank you.
Thank you very much.
I think, I think I just want to add it to that point also, because when I went to the field, I feel like that the lack of awareness among the rural people is also an additional factor, because we say that the urban people are more educated and they have the knowledge of not burning plastic. I have seen many of the rural people burning the plastic, and they are actually getting diseases into many ways because of this lack of scientific awareness.
Yes. Yeah, that's a very pertinent point. Yeah. So it's like the community, there is a difference in the level of awareness between the two urban and rural populations. But the level of importance that community gives to issues like air pollution is another important concept, because it is not something that is apparent on a day-to-day basis. So even though we are being exposed to air pollution, short-term effects are quite limited. So everything happens at a subclinical level, and the effects that we see occur after many years. So that is one thing that makes the community quite docile, or rather passive about considering changes, because whatever behavioral changes they need to do to reduce their exposure or their emission of pollution actually has an economic aspect to it. So yes, that is something, maybe that something can be targeted by working with the community, by using CBPR methods. So that's a food for thought.
Thank you very much. I think you can also put your questions on discussion forum, where the respective faculty can discuss, can give you reply. So now we move on to our third presentation, and it's on water. And I invite Dr. Surya Singh, Scientist B, to give her talk.
Good morning, everybody. Am I audible?
Yes.
Yes.
Okay. And the screen is visible to all of you?
Yes.
Okay. So let's start. So myself, Dr. Surya, Scientist B, working in ICMR NERE. And I believe you all must be enthralled after listening the previous two lectures on environmental health and air pollution. So let us now focus on another very important aspect of environment, which is water. So we will just see not about the water pollution, but also the other facets of the water, which are important in the environment. So let us start with this. So first of all, we have to understand why this water is important for human, means what is the importance of water in the human life. So if you are from the medical background, or even if you are not, you must have been knowing these things, that human body is approximately 60% made up of water, and different organs of the human body, they have in different proportions, they have the amount of water in that. So it is very much important for the functioning of our body, and water plays a very, very important role in various functions of the body, whether it is metabolic functions, physiological functions. It helps in digestion. It helps in maintaining our body temperature. Like, you know that in the summer seasons, we sweat more. That is only due to regulating our body temperature. Then also water helps in maintaining a balance and homeostasis into the body. So this is how we can understand that how important water is for the human life and for various functions of human body. this is about the importance of water in the human life. Now we will see how much this water is present in the nature, because we get this water from the nature only. So if you see this picture shows size of the earth, means you can compare the size of the earth, and the biggest drop of water that you are seeing here, the blue color drop, that is the amount of water present on the earth's surface. So you can imagine that how small is this amount of water which is present over the earth's surface. And surprisingly, approximately 96 to 97% of this water is just present in the oceans. And when I say that it is present in the ocean, it means it is the saline water, means having a very high salt concentration. So directly we cannot use this water for drinking purpose or bathing purpose. Obviously, there are some techniques through which we can desalinate this water and then we can use it for drinking, but those methods are quite, costly and also not very convenient to practice everywhere. So basically, the oceanic water or the saline water we cannot use for drinking and bathing purpose directly. So if your 97% water is gone, then very little amount is remaining, right? And that also is not actually usable for us, because a significant amount of that water is also capped in like glaciers and ice caps, like in Antarctica, there are glaciers and other things. So that water is not directly usable for us. So if we exclude that part as well, then approximately I can say less than even or maybe just 1% water is there on the Earth's surface, which we can directly use, which is present over these as the surface water resources, like in the rivers, lakes, or maybe the underground water that we extract from beneath the earth. So just 1% of the water is there, which we can directly use. So you can understand how scarce this resource and how judiciously we need to use this source, because already we have seen that it is important for our body functions and it is very much scarce. So now we will see what are the various social and environmental concerns related to water. Generally, when the water terms surface up, we generally think about the pollution, but water scarcity is another very important factor that we need to look into. So scarcity of the water means all the water is very less, and whatever water is present over the Earth's surface, that is also completely not usable. So scarcity is one of the issue. Then another issue is the pollution. We all know about it. Then there are some other facets like conservation. Whenever we talk about scarcity, conservation terms comes into picture. Then water supply, because sometimes what happens, maybe having a significant amount of water at one place, but we are not that much efficient to transfer that water to the place where it is actually needed more. So water supply is an important part of the overall water thing. Then management of the water, which is basically about the budgeting of the water, how much water we can consume, how much water we are wasting. So all that management comes into this. And then sanitation, which is a very important part of the overall water theory, because if the sanitation is not proper, various health issues emerge. So all these components are very much important, and these combines both the environmental as well as social concerns. But covering all these things into this 20 minutes lecture is not possible. So we will mainly focus on the two issues, which is scarcity of the water and the pollution. So let us now start with the water scarcity, what it is, and what are the major reasons behind it. So if we just look at the situation worldwide, so as per the data, approximately 2.2 billion people don't have access to safe drinking water. And that is because of the water scarcity, because water is less. So the people who are not that much, which are not very rich, or say in some different parts of the globe where there is not much water, means there is a scarcity of water due to the geographical reasons or other things. So these many people don't have access to safe drinking water. And obviously, if the water is not present for even the drinking, sanitation is far ahead. So because of this, without this safe sanitation, diseases also spread rapidly, and approximately 4.2 billion people are at the risk. Then children are more at risk. Why? Because children are, they are the people of growing age, and they do not have that much immunity as the adults have. So obviously they are more at risk. Then climate change is making it worse. It means that climate change is one of the factors which is responsible for causing the water scarcity, although there are many other factors as well. So this is the situation that we are facing all over the globe. So now let us try to understand that why is there this scarcity. So as I said, one of the factors is the climate change. Because you all know that climate change is basically anthropogenic. We have created so much disturbances in the environment that the climate change is taking place. Rainfall pattern has changed. Our entire season system is getting changed, right? So because of all these factors, precipitation pattern has changed, and that causes scarcity. Then there are natural calamities. Suppose some drought kind of condition happen in some place. So that is also one of the reasons that scarcity is there. Then because of the imbalances in the precipitation pattern, sometimes floods also occur. So you might think that in the flood condition, there is a lot of water, but actually that is not the usable water, because that is contaminated. There are lots of silt and dirt and other things. So directly that cannot be used, and that also pollute the other safe sources of the water. So these are one of the important factors. Then population, obviously, one of the biggest reason behind this water scarcity, because you all know that Earth is having a certain carrying capacity, right? So, but we as a human, we are keep on increasing the population, and it is not just the human population. We have to think about other living beings on the Earth's surface, because the resources of the Earth are limited. There is limited water, there is limited space, different forest resources. So if the population is keeping on increase day by day, then obviously the resources will be scarce. So population is one of the major factors. Then wastage. You might have seen maybe in your home, and if not in your home, then in your neighborhood, you might have seen that some people do cause loss of wastage of water. So that is also an important issue. Then overuse of aquifers. Aquifers means natural water body, mostly beneath the Earth's surface. So that stores the water or transmits the water. So this overuse of aquifers is actually related to the increasing population only, because when we are increasing the population, then we have many people to provide safe drinking water. So for that, we keep on taking very deep into the Earth's surface, and we keep on extracting the water. So that causes shortening of water beneath the Earth's surface as well. Even the underground water resources are getting depleted. So that is also one of the reasons. And then pollution, of course, because already we have the scarce water resources, and whatever resources are there, we are polluting them, not only because of the domestic reasons, but industrial reasons are there. So these are the some of the important factors which are responsible for causing water scarcity. Then moving on to the water pollution. So we all know what is the water pollution. Basically, we understand what it is. But let us see the situation, especially in India. I guess you all must have seen this kind of situation. I have shown the river Ganga, the national river of India. This river, and this is very much important for Indians, and not only for the livelihood, but also there are lots of medicinal properties as well in this water. But unfortunately, River Ganga is also among the top 10 polluted rivers of the world. Then River Yamuna, you might have seen this kind of condition where lots of foam is there, and water is so much polluted that it is even difficult to identify it as a river. So these are the situation of one of the important surface water resources in India. Now, this is the picture. It shows the reality of the groundwater. It has been taken from the Gujarat, and this color and this kind of picture is there because of the chemical contamination. There are lots of fertilizers and pesticides which are indiscriminately discharged into the groundwater, and that causes this kind of situation. Then this picture has been taken from the Karnataka Velandur Lake, which is one of the very important lakes in the Karnataka. And few years back, this lake was the basic source for the livelihood of approximately 18 to 20 villages, which were situated across these lake. But now the situation is like this, that there are a lot of foam and other kind of, even fire also takes place in this lake because of the various chemical contaminants which are being discharged into this lake. So this is the situation of water pollution, especially in India, that we are focusing. So you can just imagine that already we are water scarce, and then there are these many sources of pollution. So now let us see what are the basic sources of pollution in the water. Fundamentally, we can categorize the sources of pollution into four. First is the domestic sources of pollution, and it generally includes the sewage part, which comes out of our toilets. And another important term that you must understand is the sewage. Sewage is actually the wastewater which excludes the sewage part, like water that is coming out of your kitchen sinks or your wash basins, or maybe after bathing. So that comes under the sewage part, and both the sewage and sewage, they together constitutes the domestic wastewater pollution. Then industrial source, of course, industrial source of pollution is very much important because industries discharge a lot of chemicals, metals, and various other pigments, dyes, and other things which are very much harmful. And I must mention here that it seems that industrial pollution is very difficult to manage as well, and it is very important. But, you know, if I take the example of River Ganga, so in the River Ganga, approximately 70 to 80% pollution is because of the domestic sewage, not because of the industrial discharge. Although it is known that there are lots of industries at the bank of River Ganga which discharge a lot of chemicals, but still approximately 70 to 80% is only because of the mismanagement of domestic waste, and that gets discharged into the River Ganga. Industrial constitutes approximately 20% or so. But yes, quality-wise, if we see, then industrial sources of pollution are much more harmful because that contains lots of chemicals. Then the third important source of pollution in the water is the agriculture source, and generally it is not considered as a source of pollution, and many people are not aware of it. But you all might be knowing that in agricultural practices, we use lots of agrochemicals, is basically the fertilizers and pesticides, which are nothing but the chemicals. So when these chemicals are applied onto the agricultural fields, then after a certain time, when the precipitation takes place, rainfall, I mean, or maybe because of the irrigation water, these chemicals gets washed off from the field, and they contaminate the underground water because it gets leached down into the water soil surface. And also, if there is some nearby water body, river or lake, then also this water contaminates that surface water body. So this is also very important source of pollution, which is often neglected, but it should not be. Then fourth important source of pollution is the socio-cultural sources. And it is only because of our social cultural practices that we follow. You might have seen that there are lots of, throwing of various flowers and other things, organic material into the water bodies. Then, idle immersion, and also sometimes you might have seen that people used to throw the dead bodies of animals even in the rivers. So that is all part of the socio-cultural practices, but yes, that should not be practiced. At least we have to be that much aware that we should not contaminate our water resources due to these reasons. So now if we see the basic parameters for assessing pollution, right? Like if you have a water sample, how would you say that whether this sample is polluted or not, right? So how to assess that contamination or the pollution? So there are four basic parameters through which we can do this. The first one is the bacteriological and the virological parameters. This involves the assessment of various bacteria and viruses which might be present in the water. So we have to check for those organisms in the water. Then there is biological contamination, and you must understand this biological and bacteriological and virological are two different things, right? Biological means some kind of biological organism would be there, but it's not the bacteria or the viruses. Biological organisms might be like, like Ascaris, helminths, and other kind of, especially the platyhelminths and Ascahelminthes group of organisms are found in the water. So you have to also check for the biological presence of the water biological presence of the organisms in the water. Then a third parameter is the physical parameter, and we are generally aware of this thing. Like if the color of the water is not good, we generally sense that this water is not good. Then odor, pH, taste, turbidity, and dissolved solids means, if the water is looking very turbid, lots of dirty material is there, then we generally consider that this water is not safe or it is polluted. Then fourth parameter to assess is the chemical parameter. And it involves investigations of the presence of various metals, metalloids, pesticides, fertilizers, various kind of pigments or dyes, tannins, etc. So whenever you have to check for the water quality, you have to go through these four levels. You have to check for the bacteriological, virological presence, and obviously it should be 0. Then biological presence of the organisms, physical parameters, and then chemical parameters. So now, if we look at the diseases due to the contaminated water, and I guess you are from the public health background, so you must be aware somewhat about it. So basically, the diseases or the categories that I have mentioned here, it is based on the bacteriological, virological, and biological parameters. So waterborne diseases are the diseases in which infections happens because of the consumption of having contaminated contaminated water or the drinking water, like cholera, dysentery. These kind of diseases do happen because of the presence of some biological, bacteriological organisms in the water. Then water washed diseases is directly links with the sanitation and hygiene part. As I said, even if the water is there, but if you do not have sufficient practices of, like if you are not having good practices of sanitation and hygiene, then you can develop these kind of diseases, basically skin diseases or other kind of conjunctivitis and scabies, etc. Then water-based diseases are basically the diseases which gets transmitted through any aquatic invertebrate organisms. As I said, platyhelminths or Ascahelminths. Then water-related vector-borne disease, this is very much common. We all know about the malaria and dengue and other things in which mosquito plays an important role in transferring those diseases. Basically, water is harbored by mosquitoes to complete their life cycle. So this is how we can categorize the diseases which happen because of the presence of various bacteria. Various bacteria, viruses, and biological organisms in the water. Then there are also diseases due to the chemical imbalance. So if there are some imbalances in the chemical constituents, I hope it is audible to all.
Yes.
Okay, so if there are various imbalances in the chemical constituents of water, like I have shown the pictures of skeletal fluorosis, dental fluorosis. It is basically happen because of the imbalance in the fluoride content of the water. As per the standards, the amount of the fluoride present in the water should not exceed 1.5 ppm or 1.5 milligram per liter. If it is higher than that, then it might cause fluorosis kind of conditions. Then you all must also know that fluoride is not just a pollutant. Actually, a limited amount of fluoride is also necessary for our for our body. So that is why I am calling it the imbalance, because there have to be a range in which a chemical constituent should lie. If it is beyond that range, either on the lower side or the upper side, it may cause problems. So you have to have the balance of various chemical constituents in the water so that it can be safe and potable. Then if there is arsenic contamination, it can cause skin lesions, and arsenic is also one of the important cause of cancer as well. So these kind of diseases do happen because of the chemical constituents of the water when there is imbalances. So now if we look at the disease burden due to the contaminated water, so it is the, globally we can say that 1/6 of the global population lacks improved water supply. So obviously, if there is not a good amount of water supply, people would either there would be a scarcity, and if there will be a scarcity, then chances of pollution would also be very high. Because in case of water scarcity, there would be higher chances that sanitation and hygiene would not be practiced, right? So scarcity and pollution actually somewhat go hand in hand. And then another important fact here is that majority of these people who are under the risk of disease due to the contaminated water are in the Asian and African continents. And this is so because Asian and African countries are in the developing phase. They do not have enough resources for their people. So either we are not able to supply them a good water quality, or scarcity is also one of the factors. So these countries are more under the risk. Then global disease burden from water and sanitation is approximately 4% of all the deaths. And I must tell you that this data is not very recent, so there might be some change in these values as well. But yes, it is an important factor. So this is the level of disease burden due to the contaminated water. So now the question comes, what we can do, like if we are seeing this kind of situation of water scarcity and pollution, what we should do, what's the solution for this? So if we talk about the solution, so first we will look how we can maintain a good water quality. As we have just seen how water gets polluted, there are 4 different kinds of sources: domestic, industrial, agricultural, and socio-cultural. So how we can maintain the good water quality? So for that, we have to focus on these 5 things basically. First, we need to identify the possible sources of contamination in the water. Like in your vicinity, in your neighborhood, you have to identify what could be the possible sources. For an example, suppose you are living in a place where you are seeing that there is a sewer pipe is going on. Right. And if you see that there is some leakage, so obviously whatever water will come out from that sewer pipe, it will contaminate the soil, and then it will leach out and it will go deep down into the earth. So this is one of the sources of contamination. There may be some other sources. So you have to identify what could be the possible source. Then you have to go for the quality evaluation. Like you have to check your water quality regularly. It is not just the one-time task. And as I mentioned here, periodic checks. So these 2 are important, because water is not that if your water is safe today, it will be safe tomorrow as well. So you have to regularly, periodically monitor the quality of your water. And if there is some imbalances, then you have to report. Then there are some control measures, like if you have identified what is the source of possible contamination, and if you have seen that quality is degraded, then you have to have some measures. You have to adopt some control measures. You can, if it is in your hand, you can directly adopt some measures. Otherwise, you can inform the authorities, the government authorities, municipal authorities that there is some issue, and then they have to look for it. So control measures are very much important. Then, as I mentioned here, as implementation of rules and regulations. In India, there are various rules, and also there is a Water Pollution Prevention Act 1974, which emphasizes about the various rules and also a number of penalties that may be caused to the person who is causing the water pollution. But in many of the cases, it has also been seen that it could not be followed in proper manner. So proper implementation, follow-up of guidelines, it's very much important. So this is how we can maintain the good water quality. We can have regular visual of our water resources. If I take some examples to explain this more, then there are some success stories in this as well. And one of these stories I have taken from the Nilgiri of the Tamil Nadu state of India. So there was the issue of poor water quality. And because of that, the people of that region were facing a lot of health issues, especially skin related issues, allergies and other things. So what they did an intervention. And first of all, they made the community aware of this, that this health issues that people are facing, it is due to the water related. And then they started the testing of water. Regularly, they have started monitoring of the water, and they carried out testing. And the impact was seen after some time. And it was seen that now people are aware, and now they are free from those kind of diseases that were actually happening because of the contaminated water. Simple solution of even just boil the water before consumption, that also makes a big difference. So this is how the people of Tamil Nadu made their water quality better. Another example I have taken from the Gaya district of the Bihar in India. So what was the issue there? They have found that their groundwater is actually contaminated with fluoride. And as I have earlier also shown, that fluoride has to be in a limit. If it is exceeds, it causes fluorosis. So those people found that this water was contaminated with fluoride. So first of all, what they did, they made the community aware again, because community awareness is very much important if you have to deal with any kind of environmental issues. So they made the community aware. And secondly, they constructed some rainwater harvesting units. What are these units? I will discuss after some time. So they constructed the rainwater harvesting units and also the defluoridation units. It is a kind of a small unit which helps to eliminate the fluoride content from the water. So after the installation of these kinds of units in their village households, they found that now their water is free from fluoride, and they could now access the fluoride-free, safe drinking water. So these are just the stories at the community level, what they did. They have not took much intervention from the government side. They did it on their own. So this is how we can tackle the pollution at our end. Now moving on to the replenishing water, because I have earlier discussed about the water scarcity issue. So now we have to find the solutions for that as well. So how we can get some solutions to address the problem of water scarcity. So the basic thing is to stop wasting water. Whenever you see, either in your home, in your neighborhood, or to any person, if it is they are wasting water, tell them that it's a very scarce resource and we should not waste the water. Then another important thing is to reuse the water. At your home, at your domestic level as well, you can reuse the water. If I take the example, suppose if you are washing your car, and if you are not using any kind of any chemicals or other things, then definitely you can use that water for your gardening purpose. So it is the reuse of the water. Don't just waste water from one thing and just discard it. You can reuse a many number of times, depend upon what is the quality after the use in one purpose. Then increase the vegetation, because you all know that vegetation helps in binding the water. The roots of the plants, they bind the water into the soil, and then it remains with the ground surface for the long time. So vegetation has to be increased, and also it maintains the various other important aspects of the environment, like it regulates the temperature, and also it helps in the precipitation. So vegetation has to be increased, and this also can be done at your own level. Then human-made lakes or reservoirs, because nowadays we are seeing that everywhere there are concrete structures. We do not see any natural kind of water body. So we can ourselves create some water bodies. We can have some pond or lake we can develop, so that whenever the precipitation will take place, rainfall will take place, water will be automatically stored in that body. And with the time, that water also enrich the underground resources. So human-made lakes and reservoirs can also be built up. Then rainwater harvesting, that I have just mentioned. It is the collection of the rain that is falling over your rooftop. So you have to just assemble some small things, and you can just collect the water that is falling over your rooftop, and then you can transfer this water into, maybe you can dig up a place nearby your house where you can collect the water, and later you can use it. And if you are installing some kind of filters also there, then you can use it for drinking purpose as well. So rainwater harvesting is very much important, because whatever water is getting precipitated, that should not go waste. Then artificial recharge. This is basically cannot be done at our domestic level. When there is extreme scarcity of underground water, then generally we dig up a well, And then we supply the water from outside to the underground aquifer so that it can be recharged. So this cannot be done at the domestic level, but yes, this is one of the solutions to replenish the water, underground water. Then zero liquid discharge. This particular term is basically related to industries. It has been emphasized by the Central Pollution Control Boards few years back that the industries which are very which use a lot of water, they should go for zero liquid discharge. It means that they should not discharge any amount of water, and whatever water is being used in the industry, they should recycle it and should reuse it. So that is the concept of zero liquid discharge. Means all of the water that you are using, you have to reuse it. You have to recycle and reuse. Then water extraction policy. This is the policy matter at the level of government. They must have some water extraction policy. So whatever water we are extracting from the ground, it should not go beyond a certain limit. So these are some of the ways through which we can replenish water. We can get some solution for the water scarcity. And I have also found some case studies in this as well. So this story I have taken from the Singhbum district of the Jharkhand, where the water scarcity was felt by the population, and this was due to the groundwater depletion. So what they did, they just I have mentioned human-made lakes and reservoirs. So what they did, they digged up 70 ponds in the block. And whenever precipitation happened, those ponds get filled up, and then they use this water for various their needs. So this has created not only just their fulfill their need, but also it recharged the groundwater. So that helped in the restoration of the groundwater, and also those people were aware now, so they have stopped wasting the water. So this is one of the case study in which people themselves came up and solved the issue of water scarcity. Another story I have taken from the Bhilwara district of the Rajasthan, in which, you know, that in the Rajasthan, it's a very water scarce, and women used to walk a lot to fetch water for their family. So they have also done an intervention. First of all, they made the people aware. They made them water literate. They made them aware that water should not be wasted. And then they constructed again water harvesting structures. Either it can be pond, it can be wells, it can be lakes, something like that. And then they used to collect the water, rainwater. And then when it was needed, they could use that water. So this is how we can we can do the intervention at our own level. And the main purpose of this course is also like we can have in the community in itself, how we can find the solution of various environmental issues. So at the end, if I summarize this story that I have been narrating so long, so it is actually, we have seen that it is very much essential to make the judicious use of water, because we have
particular line paper
because we have already seen that water is scarce, and whatever scarce sources are there, those are also polluted. So we have to make a judicial use of water. We have also seen that clean and safe water is very much essential for good health and well. So we should avoid polluting our water. We should avoid water. Then regular monitoring and periodic checkups are very much necessary to keep our water quality intact. So we have to make it a practice to monitor the water quality regularly, and community intervention. Can you please mute yourself?
पेपर तो डाउनलोड हो जाएगा जब ओपन है, यही वाला है ना.
Community intervention plays a very important role in water quality and replenishing. So this was all about the water, and I would be happy if you have any questions.
22 की छुट्टी है. मैं तो सोची थी 29 की छुट्टी है, ईद उन पे.
So if you have any further queries or questions related to water, you can ask.
Or you may also mention in the chat box where I can answer.
I think it's not basically a question, but in reference to the community thing. I mean, like, there are nowadays online portals are also there where people can do the testing. The gram panchayats are also given the testing kits and all. But unfortunately, somewhere that importance generation for the water, I mean, how to make it kind of, we know it or we understand it, but like Har Ghar Jal, Har Ghar Nal kind of policy where people think that the government has to provide them water. It is their responsibility. So somewhere water is not becoming a people issue. It's being driven away from the people. So that's a challenge. I understand it's a more not at a scientific angle, but it's more of people's or community angle. But how to, I mean, it's and lack of the political will or the direction of the political will is also very different. So how to, that's a big question. I mean, in terms of when it comes to the action at the ground level.
Yes, that's very important. And I must say that at our own level, political will develop after a certain time when the people will be aware. So first we have to start from our own and locally we can start taking initiatives at our own level, domestic level, and then at our community level. And then when the government or the local panchayats, gram panchayats, they will see that the people are aware, then obviously I guess they would be forced to take some actions. So this is how we can motivate them. Actually, we have to start from ourselves. Then only they will get motivated.
Yeah, we are doing a bit in terms of springs rejuvenations and spring restoration kind of thing.
There are various methods. Water scarcity, of course, it's a problem, but there are number of methods through which we can rejuvenate the things. So we have to just be aware of these things. That's the only issue.
Yeah, thank you.
Okay, thank you. If you have any more questions, you can put it in the chat box. Thank you.
Okay, thank you very much. So I think these two sessions on air, water, and the introduction to environmental health, I am at present skipping the soil part that we can take on 20th. So the idea of this session was to give you some background about various environmental aspects or issue on water, air. We will also talk about climate change, built environment, and soil on 20th of April. And this will give you some background about issues that can be taken up when you will listen the CBPR or community-based participatory research method. So it's a very basic, but the thing is that how to implement that that in communities is still a challenge. As Mr. Narendra Paul said that the water is not, it's not in agenda, or it's only not a political will. So the one point is like we are providing house to house, like pipe water supply under Jal Jeevan Mission. But the real challenge is the sustainability of the system, whether the community will keep that system working for long. The infrastructure provided in Jal Jeevan Mission in schools they are keeping intact, or what type of things need to be done so that the community understand different issues related to these resources. So these all are issues which it's very easy to talk very like in terms of scientific thing, but when it comes to community, we have to think about how in easy way how we can communicate the issues, how we can discuss with them, and how we can develop an intervention where the community can participate and then run their own things. So these are all things which you need to understand, and I will request you to read at least once the content which is provided in the Moodle dashboard, and also please start discussing the point which you think are important in your area or what you feel is important. Then we can also give some comments and put our viewpoint on that. it is very important to discuss things, and then other participant can also provide their viewpoint on discussion forum. So if you have any further questions, you are welcome to ask. Otherwise, we can end this session, and then we will meet again on 20th at 10 a.m.
Sir, will these presentations or the link to the recording will be shared at the Moodle?
Yes, yes.
Okay, thank you.
I will share to the my Priya colleagues, and then they will upload on.
Thank you. Thank you.
Okay.
Thank you, sir.
Thank you. Thank you, sir.
Thank you very much. Bye.